League of Women Voters San Diego Sustainability and Environmental Action Committee meeting. Welcome to our participants and our guest speakers. Thank you so much for being here. I'd like to ask everybody to mute while the speakers are presenting, and then to put your questions in the chat or raise your hand, and we'll do questions at the end of the presentation. So before we get going, I'd like to thank two people who helped make this possible: Kristin Pereira and Joanne Julian, both health planning and program specialists with the Public Health Services of San Diego County. Thank you both so much for making this happen. Our first speaker will be, I wanted to do one more thing. I'm sorry. I'd like to read to you our mission statement of the SEAC committee, the Sustainability and Environmental Action Committee, so that our guest presenters will know actually what we're all about, and some of our new participants today. But our mission statement is: the purpose of SEAC is to monitor public policies critical to all aspects of climate change, and to advocate for and influence the improvement of such public policy consistent with League of Women Voters positions in order to promote sustainability and environmental justice for all community members. So our first presenter today is going to be Wilma J. Wooten, MD, M.P.H. She is a public health officer and director of public health services in the County of San Diego Health and Human Services Agency. She received both professional degrees from the University of North Carolina, Chapel Hill, followed by the completion of residency training at Georgetown Providence Hospital Family Practice Residency Program in Washington, D.C. In 1989, she completed the joint San Diego State University Graduate School of Public Health, University of California, San Diego, Preventative Medicine Residency, with an emphasis in sports medicine. Dr. Wooten practiced medicine as a faculty member in the UCSD Department of Family and Preventative Medicine from 1990 to 2001. She remains a UCSD volunteer associate clinical professor and is an adjunct professor. She has been with the County of San Diego Health and Human Services Agency since 2001, initially as the deputy health officer, and now serves as a public health officer since February 2007. She has a strong interest in health disparities and health equity. Dr. Wooten is a past board member and past president of the California Conference of Local Health Officers, current board member and past president of the Health Officers Association of California, past member of the advisory committee to the director of the Centers for Disease Control, the CDC, and past board member of the National Association of County and City Health Officials. Dr. Wooten is a current board member of the Public Health Accreditation Board of Directors and chair of the same. She is also a member of the Big Cities Health Coalition and currently serves as chair. Our second guest speaker is Kristin Guirguis. Kristin is a project scientist at Scripps Institution of Oceanography, whose research includes regional and global climate variability and change, weather prediction and predictability, climate and weather extremes, and impacts on human health and society. Her recent projects focus on improving predictions of atmospheric rivers, heat waves, and fire weather in California on timescales important for emergency preparedness and resource planning. Her work has contributed to recent state and regional climate change assessments, and she actively participates in multidisciplinary collaborations with government agencies and organizations motivated to mitigate health impacts of weather extremes and climate change in the San Diego region, California, and Western US. Thank you so much to both of you for being with us. Dr. Wooten, the floor is yours.
Thank you so much, Ruth. And thanks to your organization and you and your leadership for inviting us to speak to you today. And we hope to share information about the health impacts of climate change. In the next slide, this is the objectives and the topic areas. Next slide that I want to share with you today on the left side. So we're going to focus on climate change and public health in San Diego County. and identify what is the problem and who's at risk, and then move to the impacts of climate change, focusing on 3 specific areas: excessive heat, then wildfires and air quality, and then lastly, vector-borne diseases like West Nile virus, which I'm sure you've all heard about. And then what has county public health done? And halfway through that, I will transition to Julian, and she'll talk about many of our partnerships, what individuals can do and what your organization can do. But I think your organization probably could teach other organizations, because you've been quite busy and productive in this particular area of climate change. Now, on the right side, just want to point out that the Intergovernmental Panel on Climate Change is a group. They are the leading experts in climate change scientists, and every year they convene a conference. So I put the link at the bottom so that you could look at what are the primary focus areas that they are currently identifying. So if we move to the first section that we want to talk about in the next several slides after this slide, if you can move next, Joanne.
For some reason it's not advancing. Does anyone know why it wouldn't be advancing? Is there a trick to that I don't know about? It's not moving to the next slide.
There you go.
Okay, good.
If you use the arrow button, I don't know if
Yeah.
Okay. All right then. So in this next section, as I stated, we're going to talk about climate change and public health, and particularly focus on what the problem is and who's at risk. In this slide, you see 2 prominent individuals who are leaders in 2 organizations: the World Health Organization, as general director, on the left, and on the right, the president and CEO, or the executive director for the American Public Health Association, Georges Benjamin. And both of these organizations identify climate change as a significant threat to public health. Now, in our next slide, in 2019.
Oops. Dr. You just muted.
Interesting how that happens. I didn't touch anything. Just 1 second. Sorry, it's sticking for some reason. Let me know if you can see that.
Not yet.
Okay, let me just try and read.
One of the things to think about or to make sure is that you've got that window active as you go to advance. So sometimes if you move your cursor to something else, then you've got to put it back there and click. Okay.
Thank you.
You
ready, Joanne?
I think so. I hope so.
Okay. So this slide is being shown because in addition to the World Health Organization and the American Public Health Association, many other national organizations have also band together to create a call of action on climate health and equity. And 74 groups, including the American Medical Association and the American Heart Association, describe climate change as the greatest public health challenge of the 21st century. So this really has the ear of many national health organizations. In the next slide, bringing the issue closer to home. This is a graphic that was adapted from
I'm on your laptop as well.
CDC and modified and put out by the California Department of Public Health. It sums up the major impacts of climate change, and it's designated by the 3 red circles. Those are the 3 focus areas that we will provide you information about what's going on in San Diego. So those 3 include excessive heat, air quality, which is influenced by wildfires, and vector-borne diseases. Now, this is a quote from the states, it's a document called Safeguarding California Implementing Action Plans, and it's the public health sector plan. And this document states that the most immediate and concerning impacts for vulnerable populations continue to be extreme or excessive heat, air quality, which is caused predominantly by wildfires, but also it can be caused by just increased heat in causing a change in the ozone, particulate matter, which comes from wildfires, as well as emissions, car emissions, and then allergens or other air pollutants. Intermittent years of excessive precipitation or a lot of rain associated with El Nino can cause coastal and ravine flooding. As well, on the extreme, we have prolonged droughts. So all of those are influenced and impacted by climate change. So in the next slide, just who is at risk for the public health impacts of climate change? And the answer is quite simple. It's everyone. And this just basically shows the rainbow of individuals that are impacted, from the very old or elderly population, or I should say the mature population, to the very young, pregnant women, outdoor workers, people who are unsheltered, particularly and homeless, those people who suffer from mental health issues, and people who are isolated socially or geographically or due to language barriers. So again, everyone is at risk. All of us here are at risk. In the next slide, as any local health department addresses climate change, the first step is to identify risk and vulnerability. So over the past several years, the California Department of Public Health conducted a vulnerability assessment for local health departments, and each health department has its assessment. And this is San Diego's assessment. Unfortunately, the original document was not published, but in subsequent years, there is an update for this information that's on CDPH's website, and we provide the links on the page. So you see the link at the bottom there. So San Diego County's vulnerability risk was scored relative to other counties in the state and the state's overall rate as well. Heat and wildfires were two of the highest rated risk vulnerabilities in the environmental exposure domain. So there are three domains. If we can go back, Joanne. There are three domains where information was gathered. The top is environmental exposure domain, then the middle purple is the population sensitivity domain, and then the third is the adaptive capacity domain. For San Diego, in the first domain, again, the two highest areas were heat and wildfires. If we go down to the third domain, the three areas that were highest areas that were identified included lack of tree canopies, as well as impervious surfaces, which is just a fancy word for concrete jungles, and then public transit access. So those were areas that were identified. And actually, if I can go back, you can go back to that. Those arrows, they should be elevated up. It looks like they're misplaced. It's the first three. Transportation is not included. So it's air conditioning, tree canopy, and impervious surfaces. Now, moving to the next slide, it's the same three domains, but the colors are different. And this was done later. The last slide was done probably about 2016. This is a more recent determination. We actually captured this information from the website this week. But now for San Diego, there are 10 areas that are above the state's vulnerability, state's average for the various vulnerability indicators. And San Diego, these 10 from top to bottom, starting out in the environmental exposures, which is the blue bars. It's the percentage in high wildfire risk, percentage of people that are at risk in areas that are at risk for wildfires. The annual mean particulate matter, or PM 2.5 concentration, and extreme heat days. So that's in the blue bars. Then that's the environmental exposure. Population sensitivity includes individual information. Those are the orange bars. Percentage of households without English speakers, percentage of individuals over 65, and percentage without health insurance. And then the last category, adaptive capacity, are those three areas again. Percentage of households without air conditioners, percentage of impervious surfaces, and percentage of communities without tree canopy. So and this is just another way at looking at those 10 areas, and we can see again that these are the 10 areas that exceed the state average. And these are areas that, whether you're an individual or an organization or a health department or any entity, can identify a plan to address those that are relevant to your organization. So in our next section, I'll quickly cover the three areas that I highlighted at the beginning: excessive heat, air quality and its relationship to wildfires, and then vector-borne infections. Going then, if we turn our attention to excessive heat, thank you. The nature of heat waves are changing in California. It used to be in the early 2000s when fire season was in October. In July of 2006, we had a very extreme heat wave that was unprecedented, and it caused deadly events in California and actually throughout the nation. 450 to 600 people died in a few days, 16,000, in excess of 16,000 hospitalizations occurred, and 147 individuals died specifically from hyperthermia. All other deaths were due to exacerbations of chronic conditions. So when you have chronic conditions like heart disease, asthma, other respiratory conditions, then you are at greatest risk for health impacts from excessive heat. In San Diego County, we saw 194 ED visits that year, 32 hospitalizations, and 2 deaths due to heat-related exposure. So since 2006, California and the nation's heat wave activity has increased, and I'll talk more in detail about that. In the next slide, as a result of this 2006 heat wave, it led our county public health department to develop an excessive heat response plan and related county task force. And as you see at the bottom, there are 3 phases to this plan. Phase 3 is when we assemble the task force, but in many cases we do it with phase 2, particularly with the first heat event in our region. This year, the first event was in February, which is quite early for the heat season. But as you'll see, now it's basically recognized that fire season is throughout the year, and fire season is caused and occurs as a result of these extreme heat conditions. So if we go back to that slide, Joanne, this slide basically shows since 2012 up through to date this year, it shows the number of heat alerts that have been issued by the National Weather Services. And the alerts are it's a heat advisory, then an excessive heat alert, and then an excessive heat warning. And the excessive heat warning is what was issued several weeks ago when we had almost 2 weeks of excessive heat, not only in the mountain and desert area, but in all 4 of the terrains, the coast, inland, then mountains and the desert. And we see that from 2015 through 2020, those were the years that had the highest number of these alerts, with the highest being in 2020. And for the past 2 years, we saw 8 in 2021. We're little over halfway. We only have about 3 months left in this year, but we've had 7 to date in this year, and we anticipate that we may have additional alerts issued before the year is over. So if we go to the next slide, now in this slide, the focus here on the left, just want to share with you that CDC recent data estimates that in the United States, on average, 702 heat-related deaths occur each year. Each year, there are over 67,000 ED visits in the United States and over 9,200 hospitalizations due to heat. Now, in San Diego, this data is from 1991 to 2019. And during that time, we've had over 2,700 heat-related illnesses that have visited the ED, and 641 people were hospitalized, and unfortunately 72 deaths occurred in this time period. And at the bottom, there is a link to CDC's tracker for those first 2 dot points. That information changes each year. On the right side of the slide, these are the consequences of exposure to heat. The mildest form of heat illness would be heat cramps. Then more severe conditions would be heat exhaustion. And then the worst would be heat stroke. And that's when actually, because of the impact of the excessive heat, individuals don't even sweat. And the goal here is not to give them a lot of fluids, but to cool them down. And this is the condition that ends up putting people in the hospital, and in many cases causes deaths. Going to the next slide. Just wanted to point out in this slide that the assessment of extreme heat and hospitalizations over the past years, the greatest impact has been seen in California. California is where most of the burden occurs, with most of the cardiovascular heart disease. If you look at all of these types of hospitalizations, all-cause hospitalizations, the most are in California. Cardiovascular related hospitalization, again, California. All respiratory related hospitalizations, California is number 2 in this area. But for the others, even California, diabetes related hospitalizations, fluid and electrolyte disorders related to hospitalizations, and renal failure associated or related hospitalizations. And California is not the largest state in the nation. Actually, it's Alaska. Some people say Texas, but Alaska is the largest state. And you see Texas, Alaska, New York. New York is actually, in terms of, it's large in population, but not in geographic boundaries. But the bottom line, California has the greatest burden when it comes to the impact of extreme heat causing hospitalizations. Now, moving to the next slide, we talked about that adaptation capacity domain, and it identified air conditioning, lack of air conditioning, impervious surfaces, and I'm forgetting the third area.
Tree
I'm
canopy?
sorry.
Was it tree
Yes,
canopy?
tree canopies. So this slide focuses on the air conditioning information. So as of 2022, only just over 56% of San Diego County residents had air conditioners. And this included those that have their own air conditioner, which was about almost 15%, or individuals that had a central air conditioning, which is just over 41%. Collectively, this adds up to that 56.54%. So when we have excessive heat situations, we can't give out air conditioners, but we give out fans. The point to remember there is that a fan is of little benefit when you have excessive temperatures over 90 degrees. It's circulating wet air, it feels like. And I'm sure many of you may have experienced that. All right, moving on to the next public health impact, wildfires and air quality. Now, this slide is from the Cal Fire, and it shows the acres burned in 2019, almost 5,500 fires and over 157 acres, almost 158,000 acres were burned. Then there's a 5-year average, which is less than the actual number of fires that were seen in the year 2020, and the acres that were burned. Over almost 4 million acres were burned in California during 2020. In the next slide, I alluded to this. Previously, October was thought of, September, October were thought of as the months for fire season. But, and many of you remember the 2003 fire, the 2007 fire. Both of those fires occurred in October, and I believe the 2014 as well too. But since then, fires occur throughout the year. So now many organizations and experts say that fires in California particularly are year round. Going to the next slide, the drought, warming, dry temperatures, wind, and human negligence are the major factors for the increase in wildfires over the past years. Wildfire season, as I stated, now is throughout the year, and it's projected to become worse due to climate change and expanding again throughout the year and increasing the number of large fires and acreage that burns each year. So as large wildfires become more widespread, the smoke from these fires causes serious health impacts. And on the right, the left slide, the side of this slide, it talks about the particulate matter, and that's what results as a result of fires. I recall that when in 2003, I was actually in Sacramento at a meeting, and when I landed at the airport, the ash looked like snowflakes, and that is larger than 2.4 micromillimeters, but the small particulate matter at 2.4 is what can get into the lungs, and it causes an impact particularly to the lung and the heart, as well as it can impact the eyes and even cause death. Now in this next slide, PM 2.5, which is the shortened name for particulate matter 2.5, from wildfires is thought to be 10 times worse than particulate matter from other sources because of the high intensity of the heat and the combustion associated with the production of this particulate matter. Mechanisms for the health impacts of particulate matter are well documented and include pulmonary inflammation that can reduce lung function through bronchospasms. And if any of you have had asthma or cold, when you have bronchospasms, the lungs basically close up. The pipes in the lungs, if you will, close up, and it's very difficult to breathe. And also, this particulate matter causes an alteration in the overall pulmonary immune system. Now, lastly, in this section, just wanted to say that at the county, through our Live Well San Diego indicators, we actually include particulate air quality as an indicator. National air quality has improved since the 1990s, but many challenges remain in protecting public health and the environment from air quality problems, again, due to primarily wildfires. The wildfires are known to be a substantial source, again, of the particulate matter pollution. And particulates less than 2.5 micrometers in diameter are dangerous, as they can go deeply into the lungs and cause triggers or worsen health conditions like asthma and heart disease. So the emerging evidence is now also linking particulate matter to premature births even. In San Diego County, we do enjoy relatively good air quality, but at times, particularly when we have wildfires, the air quality is rated poor. So this is an indicator from 2021. Air quality was rated poorly on 4.5% of days in the year 2021, or a total of 16 days last year. And this occurs in most cases, again, when we have wildfires. So like heat, poor air quality from vehicle emissions, ozone, or wildfire, as we've discussed, complicates existing chronic diseases. And again, those chronic diseases can include heart disease, asthma, or COPD, chronic obstructive pulmonary disease, and other pulmonary conditions. Moving now to the third public health impact for climate change that I will discuss is vector-borne diseases. Now, climate change disrupts our entire ecosystem, and I've talked about wildfires, but it also impacts vectors. Because of the heat, the life cycles of various vectors, whether they're mosquitoes, lice, or other vectors, their life cycle shortens, and they are able to basically be around for a much longer period of time. Diseases that are typically confined to warmer tropical climates will likely spread northward into the northern hemisphere and southward into the southern hemispheres, and to higher elevations as a result of the warming climates. An example here is that in Mexico City is actually at a higher elevation, and initially when Zika was prevalent, it wasn't seen in those higher elevations, but as time passed, the higher elevations did begin to see these infections. And basically what happens is that the mosquitoes adapt to the warmer temperatures. And other conditions, I mentioned West Nile virus, which arrived in California in 2003, and then dengue, malaria, and Zika, which I think Zika has never been endemic in San Diego, but it was associated with people traveling to endemic areas and coming back to San Diego. So in the next slide, there are a number, actually, that was, you can go back, Joanne. There are a number of various diseases caused by many different types. And this is just an array of those diseases. I mentioned the ones that are most prevalent here in San Diego, particularly West Nile virus and Zika. Now with Zika, as I was speaking about in the last slide, it is not an endemic. It was associated with people traveling to other endemic areas. But we did see in 2014 the arrival of one of the Aedes species, the Aedes aegypti mosquito, and it arrived in San Diego in 2014. Now there are three new species, or three Aedes species in San Diego that can be associated with the transmission of Zika or dengue even. But again, to date, all of those infections have been associated with traveling. The issue, however, is having those mosquitoes endemic to our area. If someone travels to another location, comes back, and they are infectious, if the mosquito bites them, then they can spread that infection to other individuals. So knock on wood, we have not had such transmissions to date, but we work very closely with the Department of Environmental Health to conduct an environmental scan. If an individual does travel, they are infectious, and we have DEHQ go out and investigate their backyard, putting out traps to see if the mosquitoes are associated in their area. And then if we can move to the next slide, this is just, yes, the map. This map shows recent invasive Aedes detections throughout the county of San Diego, as well as Aedes albopixis, and then Aedes nodoscriptus. That's the third most recent Aedes mosquito detected, which was in May of 2018. Okay, moving on to the next slide. Oh, I just want to remind people, if you want to know more about the entire vector-borne program and how our county investigates the mosquito issues, just go to Fight the Bite website, and you can find any information that you need there. Or if you have mosquitoes in your backyard and you are interested in someone coming out to conduct trappings, you can also call DEH, Department of Environmental Health and Quality, DEHQ. So in the next 2 slides, before I pass it on to Joanne, I just want to, when we talk about, and it's not really what the solution is, but this is what we've been doing in San Diego. In the next slide, it's related to CalBrace, and CalBrace is it's the California Building Resilience Against Climate Changes. This is the California version of a CDC program. CDC funded California, and San Diego County was one of about 9 different counties in California selected to participate in this program in 2014. And we were very happy to be selected. Yeah, we were one of 10 sites. And it really was just a modest grant of about $10,000 for about 3 or 4 years. But we utilize that small resource to make a significant impact with identifying who are the partners in our region, in our communities, at the state level, and then even nationally. And so in the next slide, I wanted to just specifically go through the 5 steps and share with you what we produced as a result of those actions or those steps. So the first step is to forecast climate impacts and assess vulnerabilities. So the information I share with you at the top of this presentation, the vulnerability assessment, came out of this first step. Then the second step is to project the disease burdens, which basically means communicate this information with the community so that they know what the risks are, know what their vulnerabilities are, and then they can develop plans of action. So, and we are also, Joanne and myself do a lot of presentations related to climate change, and she'll talk more about that, as well as we are writing white papers to identify what is the burden, as well as in step 3, what are the interventions that we're using to identify or to interventions that we are implementing to address the issues that we see. And that will be part of the white papers as well. And in step 4, developing and implementing a climate and health adaptation plan is basically how are we responding to these various issues. That is currently in development. And then the last step is to evaluate the impact and improve quality of activities. This is, if you're familiar with the PDSA cycle, that's is part of that whole process. You plan, you implement, you assess, and then you evaluate, and then you tweak and make changes. Now I'd like to turn things over to Joanne Julian, who will talk about our partnerships and other various resources. Joanne.
Thank you very much, Dr. Wooten. So I just wanted to give homage to a group of people who we could not have gotten where we have without them. We draw on expertise from the state and from local partners, regional partners, and this slide really just shows you the key partners that have been with us for the last 5, 6, 7 years. Scripps Institution of Oceanography, represented by Kristin at UCSD, really has been our key partner along the way, and we lean on them a lot for technical expertise. And as Dr. Wooten mentioned, the CalBrace grant really gave us that initial leg up to start exploring our vulnerabilities and the risks, but we were encouraged by the state to reach out to local partners and experts to kind of take it to the next level. And with air pollution control district experts, San Diego State University experts, as well as our friends at the San Diego Regional Climate Collaborative, Cal EPA, the Lung Association, Alex Tardy National Weather Service, Palo Band Mission Indians, Desert Research Institute, we have put together this workshop, which can be given in a 3-hour format, 2-hour format. This version today is abbreviated, but basically it's the collective expertise of air quality experts, weather experts, and together we've been able to bring this to over a dozen different organizations, including some key local partners, including the Resident Leadership Academy and NAACP and others. But basically, before we all collaborated together, we hadn't necessarily told that hyper local narrative of how does climate change impact public health specifically in our county. So I need to give credit to all those experts who've helped us to tell that story. And then we wanted to share with you also just a summary in terms of like what we have done. And then we have some screenshots for you of some of the presentations. But basically responding to excessive heat events, as Dr. Wooten mentioned, 2006 was a turning point, and the creation of our heat task force, which is led by Dr. Wooten. They have created, as a result, the excessive heat response plan, but they update that every 2 years, and even most recently developed a consumer version, which is available on our website to help people to see in an abbreviated way what that looks like. But it's basically how the county activates whenever there's an excessive heat event. In response to vector-borne challenges, again, need to give a nod to Dr. Nico Scurfield. He's our chief veterinarian for the county. And every year we participate. They put on an 8-hour vector summit, and we've been actively participating in those. And we work with him to update the slides yearly as things evolve. As Dr. Wooten, knock on wood, things have been tamped down thanks to the efforts of the vector control program at the county. But we do work closely with them in terms of bringing these key messages to our audiences when we do our workshops. Responding to wildfire events. So all of us are disaster workers at the county. So, for example, in the Lilac fire, there's a group of us that are part of something called the Partner Relay, and we would be getting messages to different communities in the event of the evacuations and making sure that life-saving information is getting translated into various languages, and that those messages are reaching vulnerable populations in the county. Implementing the CalBrace initiative, as Dr. Wooten alluded to, we just had a little bit of seed money, but we made that go a long way. And we kind of leveraged that effort, and we made a lot of connections with California Department of Public Health's Office of Health Equity Climate Change Program and other local health departments. We presented at the American Public Health Association last fall with San Francisco and Los Angeles, for example, and we've continued to keep tabs on and check in with each other in the other local health departments as a result of the camaraderie that the CalBrace initiative from the state generated for us. So we've, as Dr. Wooten said, made a little go a long way. I think also, I wanted to mention just a little bit about the outreach and education efforts. In addition to what we've already shared, we produced a Climate Change 101. And that was part of our workforce development efforts so that all of our public health staff can understand that nexus of climate change and public health. So we made that mandatory for all staff. And we used some of that funding to pay for a student that helped us to produce the first iteration of our Climate Change 101 back in 2016-17. I'm going to show you next some of the flyers from our workshops. Dr. Wooten co-presented with Dr. Cheryl Anderson. She's the Dean of Public Health for UCSD's School of Public Health, and they presented on the public health impacts of climate change. And that was in October of last year. And we have, I can share with you this slide if you, this is the RLA one. So this was in Spanish and English, and these are the flyers. This is important because the county has a program called Resident Leadership Academy, and it's a network of local residents who are empowered. They go through a curriculum, they get trained, and then with that information, they go out into the community and they do projects and do their own presentations. And so we did a 3-hour workshop for them with our partners at Scripps to basically bring these messages to the community, and then hopefully excite other people to go forward and do more on that. This is the flyer for the Dr. Cheryl Anderson, Dr. Wooten workshop for NAACP. And when you get a copy of this presentation, you can click on the link and it actually takes you right to a recording of that. And then this is what you can do, because people always want to know, how they can participate. So this is a fun slide in that it's very interactive. All these links take you to places where you can actually do something with these resources. So for example, one of my favorite things to do when I'm driving on the 5, if I see a truck that's spewing gray smoke out of its exhaust pipe, I can remember the license plate and the make and model of the car, if you're able to remember that. Or if I have a kid beside me, I ask them to either take a picture with their phone or write it down. And then I love to go to this website and report smoking vehicles. So hopefully I have been responsible for getting at least a few dozen vehicles fixed in California to prevent that. So I encourage you to look at that site. But even if you want to look at pollen count, if you want to check your air quality, and then also a couple ones to point out, if you want to know what the hazards are in your neighborhood, you can click on the California OES My Hazard site. You put in your zip code and you can see whether you're on a fault line, if you're at risk of tsunami, whatever those natural disasters and risks are right around you, you can actually see the map where your house is. And being forewarned is forearmed. So that's really great information to have. And the county has a similar site, so you can check that out. Okay, and then also in terms of what you can do, there's the San Diego Regional Climate Collaborative you can join. I mentioned the Partner Relay Network, which was the program that activates when there's an emergency. San Diego County Food Vision, we didn't get a chance to talk about food and the food system, but that's a really, as you probably already know, is a key factor in reducing greenhouse gas emissions. So the more that we can do to grow food locally, gets vehicle miles traveled down, which is what we're all striving for with reducing our greenhouse gas emissions. So lots to be unpacked there. But also, speaking of forewarned, being forearmed, there's a lot that the county offers in terms of resources for, excuse me, like the Alert San Diego, so that you can get messages. There's an app that you can have on your phone. Right before the pandemic, 2019, Office of Emergency Services of the county put out a brand new family disaster planning guide, and that's available in Spanish and English on their website. So please click on that. Make sure all your friends and family have their disaster plans. Just super quickly in terms of mitigation, these are lots of ideas. The tree planting, I believe Dr. Wooten mentioned the low tree canopy, high impervious surface being a key contributing factor to the heat island effect. Anything we can do in that respect is going to be of benefit. Energy conservation, of course, active transportation, neighbor check-ins, community gardens, poverty reduction, active transportation, and anything to do with increasing shade. What can your organization do? Final section here. So we went to your website and we were so impressed to see that you have an environmental section, and we dug a little bit deeper and we noticed that you even make reference to public health effects of climate change. And there was a lot that you were doing there. So I think really keep on keeping on, like you're doing amazing work, it looks like, from what we can tell. And I just created this slide for you. And it really just saying, League of Women Voters can continue to inform voters about the link between climate extreme weather and public health, continue to act as reliable source of nonpartisan information, which is so hard to come by these days and so valuable, encouraging civic participation, civic dialogue, and informed debate. developing future women leaders capable of critical and independent thinking, shaping public policy that addresses the public health impacts of climate change and extreme weather, such as excessive heat, continue to promote mitigation, adaptation, and resilience, continue to engage at the local and state level on legislative priorities. And then in addition to all that you're doing in those realms, just wanted to suggest that you consider potentially creating an action plan for climate change, extreme weather, and public health, and potentially engaging with the San Diego Regional Climate Collaborative. Or additionally, when the region activates more in terms of coordinating on climate change, which I believe is coming this year as a result of some funding from the Strategic Growth Council. There's a grant called, it's referred to, it's in the resource list, I'll point you to it, but the state is there's a NOFO that went out, and the Regional Climate Collaborative has applied for that to coordinate, with all the partners regionally. And Land Use and Environment Group of the county, who presented to you in May, and ourselves, we're in consultation with Darby from the San Diego Regional Climate Collaborative. We're willing to be advisors to them on that, but you all might want to get involved once that activates. But I do believe that the state will be funding most of, if not all, the regions in the state. So we put this together for you. We just broke it down by the county resources. You'll see here the regional ones, miscellaneous, they didn't fit into either of those categories. The California ones at the bottom is the RCC grant. You can learn more about that. It does have a community focus. It does have vulnerable community EJ. You mentioned sustainability. You mentioned EJ in the introduction. So I think you'll get excited when you see what that is attempting to do for us, something that's never been done before. And then, of course, you have all these great state and federal resources as well that you're welcome to peruse at your leisure. So that's it for me. Dr. Wooten, did you want to take us home?
Yeah. And then thank you, everyone, for the opportunity to share this information with you. And I just wanted to show in the last slide how this work links to our county strategic plan. And as you can see here, there is an explicit initiative under sustainability focused on climate change. And then we have the environment under justice. So there is definitely overlap in other areas, but these are the two main areas on how the work that we do in climate change links to the overall county strategic plan. So with that, I will turn the floor back over to you for any questions if you have them, or wait till after our second speaker and then take any questions. Thank you so much for this opportunity.
Thank you so much. I feel like I've just been to school. Let's go to Kristin Guirguis and have her present, and then we'll save questions to the end. Kristin, the floor is yours.
Okay, thank you. I will share my screen. There we go. Can everyone see that?
Yes.
Okay. So thank you for inviting me to speak today. So I'm going to focus more on the climate side and also talk about some of the work I've been involved with on health impacts. And just to add in, what Joanne and Dr. Wooten were saying about the importance of collaboration at Scripps. My work focuses on the science side, and we've really benefited from our work working with epidemiologists in San Diego and at different levels and everything. I think it's really important, that kind of sharing of information. And so here I have some different types of weather that we study and which are important for San Diego. We know, heat waves, marine layer clouds, which helped keep the coast cool, Santa Ana winds, precipitation regimes and extremes. So the idea here is, how our water resources are delivered and how that's changing atmospheric rivers, which bring most of our precipitation to California, but they can also, cause flooding and other problems. And of course, what we're all interested in is how these various things impact society and how those impacts are going to change in San Diego in the future. And so Dr. Wooten started her presentation talking about this July 2006 heat wave, and she mentioned how it was so it was such a destructive, dangerous heat wave that it motivated a lot of research on the topic. And she highlighted some of that epidemiological research. And so I came to Scripps in 2009, which was a few years after this, and was actually working on a study that was motivated by this event, working with epidemiologists at the state level to kind of try to put this heat wave into context of natural variability and climate change. And so this figure here is from my colleague Sasha Gershenov, which shows what this 2000 heat wave looked like. That's this large blue bar at the end of the record, and how different that was compared to previous heat waves. And so what this is showing, it's so the height of these is an expression of the intensity of the heat wave, like how hot it was, and the color is showing that magnitude measured in daytime temperatures and is red, and nighttime temperatures in blue. So what this is showing, this blue line, is that this heat wave was very hot at night. It was hot in the daytime too, but it was especially hot in terms of what is typical at night. And the reason is because it was very humid and it just didn't cool down. And so what we found then is that study from 2009 was the beginning of a trend. And this is showing what the heat wave index looks like for San Diego County, going back here to 1978. And you can see that there is an increase in intensity, but there's also a tendency for these heat waves to be really accentuated at night, meaning that it's not cooling down the same way that it used to. And that's especially important because the body doesn't have a chance to recover. As Dr. Wooten mentioned, a lot of San Diegans don't have air conditioning. So this changing characteristics of heat waves is important for health. This trend is also seen when we look at climate model projections. If you look at this figure, this inset is showing what the observational record looks like for California. So you can see how red is kind of transitioning into more blue. And if we look in the climate models, we can kind of see this trend continue. So what we expect in future heat waves is not only to have more intense, more frequent heat waves, but also more humid heat waves. And this is showing some information from the California's 4th climate change assessment. They have these different regional reports, and here I'm highlighting San Diego. So what this is showing is what the average hottest day of the year is over this 30-year period from 1976 to 2005 for San Diego. So you can see it's cooler along the coast and then gets hotter inland. And the projections for that hottest day of the year, you can see, are just expected to be dramatically hotter. And these kind of temperatures that you can see, well over 100, even 110, are very dangerous, especially when, folks are not used to them. And so it's really important to kind of understand, relationships with health, and also to improve emergency response so that we can improve outcomes, as Dr. Wooten was saying. So I think sometimes when we think about these projections as, something that's happening at the end of the century, it seems really far off. So I like to show this illustration, which is looking at changes expected for 2050 in the mid-century, which is only 30 years from now. So it's not too far off. And this just highlights how, before 2000, if we might have had like two extreme heat days per summer. But by mid-century, this is expected to be more on the order of 15 days. And given how impactful and how many health problems that can cause, those additional 13 days is a big deal. This is an example from Alex Tardy at the National Weather Service. I liked this slide, so I had him help me put it together from 2017. This is just showing an example of the kinds of responses that are needed in a typical summer during extreme hot weather. So this is just like less than a month from June 17 to July 7th, where we have 3 hikers hospitalized, medic evacuation in the Three Sisters hiking area. A lot of, seniors calling in for information about heat, and then a power outage affecting 8,500 customers. And the power outages are becoming increasingly important and common. It's partly because of the stress on the power grid, but also increasingly the need for public safety shutoffs because of fire risk. So the situation is during extreme heat, then not having access to air conditioning, which, as Dr. Wooten mentioned, is the major risk factor in terms of vulnerability. So you can see that, even adding a few days of this types of weather can really strain emergency response and cause very serious health impacts in San Diego. And then just recently, I'm sure you've heard that this past heat wave a few weeks ago, in just one day at the San Diego State Snapdragon Stadium, over 2,000 fans needed medical attention because of extreme heat exposure. So this is just highlighting some of the pre-existing conditions or medical conditions that can be impacted and exacerbated from extreme heat. And so we were involved in a study that tried to quantify that. And we looked at hospitalizations in the state of California over the 2009 to 2019 period. And we found increases in hospitalizations associated with multiple different disease categories. And overall, we found about 11,000 excess hospitalizations due to extreme heat exposure. And I think Dr. Wooten also mentioned the numbers for emergency department visits, which is much higher. So the impact on the medical system and emergency responders is very high. So one of the unique things about San Diego is that we have this varied climate where we have this, coastal communities living where it's relatively cool. And then the landscape and the climate changes pretty dramatically within relatively close spatial distances. So here, this is looking at temperatures, high temperatures from May to October. You can see that in the coast, it's usually nice and in the 70s, and then it gets hotter as you go inland. And then if you look at the percent of residents with central air conditioning, you can see that it really models the temperatures quite well, where, if you live someplace where it's usually cool, you tend to not have air conditioning. And you can see that some of these places have, 10 to 30% air conditioning saturation. And this is a study looking at heat illness in San Diego County at different regions, the coastal, inland, and desert populations. And you can see this vulnerability is different, where, so on the x-axis here is the temperature, and then this is an indication of the health risks. So it's a measure of how many excess hospitalizations there were. And you can see that this health risk here in the desert starts at a higher temperature. And that's because, these residents are used to these temperatures. They have air conditioning. And then as you go inland and especially at the coast, you see this vulnerability starts at much lower temperatures because we're not used to that kind of heat. For one, it's often cloudy and we have some protection or breezy. But then when heat waves do happen, we don't really have the defenses for it, and we don't have air conditioning often. So now I'll switch gears a little bit to talk about atmospheric rivers and changes in our precipitation patterns. So atmospheric rivers are these storms that come from the Pacific, and you recognize them by these like narrow corridors of high water vapor. And when they intersect the coastline, they can bring large amounts of precipitation. And they're very important because they bring a large proportion of the water that we use in California. But they can also be destructive and cause flooding or sewage spills. This is showing a sewage spill that occurred after an atmospheric river event in 2017. And this means that we have to close beaches because it can make people sick if they swim in the water. And so what's expected for climate change in terms of precipitation. So there's been a lot of studies that show that precipitation regime change is expected to occur where we have fewer rainy days, but then when we do get these storms, they're wetter because the atmosphere is warmer and it can hold more water. So it's estimated that we'll have about 18% fewer rainy days, but then 8% more rainfall during the biggest rainstorms. And so that means that there's more time for drying in between storms, which is important for fire risk, but then more rain happens when we do get these storms, so then that can cause more flooding. And then the potential there is the potential for more compound events, for example, heavy rain on top of burn scars. So this is a summary, fewer rain events, but stronger when they occur, flooding from heavy rainfall, buildup of pollutants entering the stormwater, and then enhanced drawing of vegetation between events. So this narrowing of the precipitation season and expansion of the dry season. So this is similar to Dr. Wooten's slide showing, how the California wildfire season is expanding. So this is showing satellite photo from a large fire in coastal California. I believe this is the Thomas fire. And this is showing what the Santa Ana wind seasonality is. So this is the frequency of these Santa Ana wind events. So you can see that these Santa Anas, they occur in the fall and the winter. And so if we get enough rain early in the season, that can buy kind of an insurance policy against wildfire for a while. But if we don't get that rain, then vegetation, coming out of the summer is already very dry. And once the Santa Ana wind season starts, then that presents a high hazard for wildfire. And you can see that, the risk or the dangers to human health can be far away from the burn scars due to the wildfire smoke inhalation, as Dr. Wooten described. And so, so one of the things that we're interested in learning more about is what to expect in terms of precipitation, regime change, and relationship with Santa Ana winds. Our research suggests that, that there are circulation changes that are tending to cause more of the types of weather that are associated with Santa Ana winds and heat waves during the winter season. This extension of the fire season and the heat waves that are associated with that has important implications for health. And I think before I end, I just wanted to highlight some information that's available at Scripps on various topics, precipitation, seasonal forecasting, snowpack. These are all like 2-pagers, so they're really short. This is this one on heat waves, which talks about this trend towards human heat waves that I mentioned. And lastly, I just wanted to highlight this report here about climate change and the impacts on ecosystems. So, plants and animals in San Diego, which is a different perspective that I didn't talk about today, but it's also obviously very important. And just to highlight that a lot of this research is not just my own. I have many colleagues and collaborators. And then, with that, I can take questions. Thank you.
Well, Kristin, thank you. Again, so interesting. And someday I'd like to know how you keep your spirits up with all of this research. But we got the questions coming in, so you can put them in the chat or you can raise your hand. But our first question is from Jeannie Brown, and she asks, are builders planning around this change in temperature? And she's noting that Snapdragon didn't have any shading, and the convention center continually has to pump out water, and rising sea levels will make this, oops, I lost it. Rising sea levels will make this even probably more worse. So I don't know if you want to answer that, Kristin, or Dr. Wooten, but so is the city planning around this specific climate change research that you all have unearthed?
I don't, Dr. Wooten, I don't know details of city planning. I am
I don't
strictly on the
either.
science side.
I don't have that intel information, but based on what happened at the Snapdragon, somebody didn't take that into consideration. So it might be, worth convening partners and city governments to talk about that issue for future planning. I think that could be a great strategy for a group like the League of Women Voters and the many partners that Joanne identified on the slide, in our slide deck. So with the funding that's coming down the pike, maybe that's something that could be suggested. I don't know, but certainly it needs to be addressed. Yes.
Certainly. Thank you. Carol Parker.
Can I just add, Ruth,
Yes.
that public health has developed what's called a Healthy Cities Framework. Climate change is a part of that. And because of COVID, the focus has really been on COVID, but we're trying to reinvigorate the interest in municipalities working collectively on an issue. And climate change has come up when we've queried people, but the devil's always in the details and getting to the next step of taking action.
Certainly. Absolutely. Mm-hmm. Carol Parker.
Hi, my question is for Dr. Wooten. You mentioned several times that tree canopies, or the lack of tree canopy, is a real contributor to heat stress of several kinds. And so, but I also am aware that the city of San Diego is not doing much to increase tree canopy. It's just a few nonprofits that are doing this, and it's actually, I tried to look into this, and there's really not much. So is the public health, is your group trying to talk to the other city departments about increasing tree canopy?
Again, the comment about meeting with cities to focus on climate change, that's on our agenda for next, not just because we're in the next fiscal year, but for next year. But it is a part of strategies, but we can only make suggestions. But we will continue to try to drive those options home. But I think every organization could, I was actually at a luncheon on Saturday where this women's organization, that's one of the things that they're doing, but it's in other countries, but it could be something that could be focused on, and just planting more trees in jurisdictions across the U.S. This is a national organization. So to answer your question, we can't control what they do, but we continuously make recommendations And that's, we got a Kresge grant in 2018, and that's where we developed this Healthy Cities framework. And it's developed along the lines of Live Well San Diego. So there's a building better health piece, there's a living safely piece, and there's a thriving piece. And the thriving piece is where climate change would reside. We can send that to you, and would welcome any support you could give to encourage municipalities to address those issues. Thanks.
Yeah.
Thank you.
Thank you. There's another question in the chat from Angie Neeson. Has the city considered partnering with the Blue Zones city project planning? All have similar goals of climate health.
Mm.
I'm not familiar with the Blue
Me-
Zones city project. Are you?
I'm not either. Blue Zones, we actually spoke to the organizer for Blue Zones when we were developing Live Well San Diego. So I didn't realize that he had tentacles in San Diego, if that's the same Blue Zone.
Mhm. Okay.
I wasn't aware.
Any other questions? Does anyone else see a raised hand or a girl?
So what's the question again? I'm sorry.
Burl's trying to unmute here.
Oh, okay. Okay.
My daughter works for San Diego, San Ysidro Health Group, and I'm just so impressed with how much the county communicates with these doctors about what the issues are and keeps them up to date.
Mm-hmm. Yeah, we have great staff and working at all aspects and across all sectors, and particularly in healthcare. So we have to have that open communication, particularly when there are over 80 diseases that are reportable by law to the health department from providers. So having that open communication is very important to ensure that people actually do that, and that we have good surveillance and investigation of those types of infectious disease cases. Thank you.
Jeannie, go ahead with your question.
Yeah, this is for Kristin. You mentioned regime change. I'm familiar with that when it comes to politics, but could you explain that a little bit better?
Yeah, that's funny. Yeah, as soon as you said that, that occurred to me, but I hadn't made that connection before. Yeah, so precipitation regime change, it's kind of referring to how atmospheric circulation is changing in a way that is changing the way that precipitation is delivered to California. So the idea is that precipitation is going to come mostly from these strong atmospheric river type storms, which just means that it's more variable, and it's harder to, let's say, contain and divert for water resources.
Okay, thank you.
So Kristin, is that a result of warmer ocean waters, or just increased heat, or why are, I mean, I'm sure those atmospheric rivers have always been there, but why are they delivering so much of a bigger impact now?
Well, so part of it is because in a warmer atmosphere, it can hold more water. So there's more evaporation from the oceans, for example, and then more water can be transported. And then, when it encounters a landmass or the mountains, then there's just heavier rainfall that comes out of that.
Okay, thank you. Jane.
Thanks. This is for Kristin. I have read in the paper about some of the forecasting models about atmospheric rivers that Scripps has been working on. And I'm just wondering, how much advance notice will you be able to give people regarding the likelihood of an atmospheric river? Will it be sort of like a hurricane, and how, tell us a little about how the prediction effort is evolving.
Yeah, so there's a big effort to improve forecasts, at for longer lead warnings. So right now, so I'm working on this effort myself, and so the kind of time scales that I'm working on are like in the kind of 2 to 4 week range. So there's some attention on that, and then there's also these seasonal forecasts, which are often use things like sea surface temperatures, and those use statistical models to try to predict precipitation, but it's a hard problem. So when are we going to have reliable 4-week forecasts? I don't I don't know. We're all working on it.
Any other questions for our presenters before we let them go? Right. Well, thank you so much for being with us, Kristin, Dr. Wooten. Yeah, just so interesting, and my mind is just spinning with ways we can plug in and just continue the education of the public, because why would somebody go hiking without water when it's 110 out?
Yeah. Or why would you go hiking when it's 110 out?
I'm trying to be generous, but right. So thank you so much. You're welcome to stay for the rest of our meeting, which is going to be very quick, or we understand if you have to get back to work. But
yes. Thank you. Thank you for the opportunity.
Thank you.
Our pleasure.
Bye, everyone.
Thank you.
Bye-bye.
So it's almost 2:30. So I think we will forgo the committee reports, but I just wanted to bring a couple of things to our attention. Our next meeting will be in October. We have a field trip planned to the Escondido EDCO Recycling Center. If anybody is interested in participating, it's going to be October 5th. You can you can sign up on the league calendar, or you can email me. And our newly formed Environmental Justice Subcommittee is going to meet on September 27th at 10 a.m. We welcome more people to participate in that. And then we have an upcoming Hot Topic Live with the League, September 29th at 1 p.m. on Proposition B, or amending trash pickup in San Diego. So that's a very important discussion to have also. So thank you all for being here. Yeah, go ahead.
Can I just expand a little on the event, which is next week?
Yes,
we have just learned that Sean Ela Rivera is going to be one of our speakers. And we have some, very interesting speakers. It will be in person at the Mission Valley Library, so there's some chance for sociability too. So I really want to encourage people to come. I think it will be a really good discussion.
Yes. Anybody have anything else they'd like to share, or? Okay. Mary Lou and Debbie and Posey, thank you so much for helping pull this presentation program together. It was just great, and can't wait till we get to talk about it. Thank you, everybody. See you next month.
Fire hose.
Bye.
Fire hose.
Fire hose.
That's